This week we're discussing community activism and personal activism. It's reaching back to the first week or two of the semester because basically when you're an activist, when you're an advocate politically, you are doing the work of a lobbyist, but you're not getting paid for it generally, and you are doing it out of your own concern with a political issue. What is lobbying? Review from the beginning of the semester. It's the act of attempting to influence decisions made by government officials, etc., etc. You are trying to influence people who make decisions so that they will take a certain course of action, adopt a certain policy, try to get policies passed. Lobbyists provide information, research, and other resources to support these arguments, to influence the process. And you can be an activist or an advocate by following the precepts of lobbying on a smaller level, and you don't have a lot of money generally to throw at the policymakers, but you do have a lot of passion, a lot of research, and a lot of ideals to do so. Lobbying is important because it makes sure that research is put before policymakers when they're making decisions. It makes sure that any individual can make their voice known. It provides access to decision makers, and even on the advocate level, you as a constituent can reach out and provide crucial information. And we'll talk about later, there's strength in numbers, so that's why nursing organizations band together to do so. The influence on legislation based on research and promoting the public interest is also extremely important, because sometimes, as we know, politicians can be in a bubble and not know what is really needed at a grassroots level. And then balancing power. It allows individuals that might not have as much money or resources to have their voices heard alongside people with a lot of money. Votes talk also. Money isn't the only thing that talks. How do you identify the policymakers you want to lobby? You want to research the legislative body, understand the structure, whether it be the state or national or, city and county here at a local level. Find out who is on there, who's on the committees, who's going to handle legislation related to your issue. Then you're going to identify the relevant officials, the relevant policy makers, office holders who are responsible for making the policy in your area of interest. Then research their background, learn about how they voted, what affiliations they have, what party they're in, what professional or personal connections that may influence their stance on your issue. It's always nice when recently in the state government here in Ohio, there's a nurse and a social worker that I've talked to recently about policy issues, and that was very nice because they could very much relate to what I was sharing. Understand their constituencies. A politician wants, unfortunately, they want to they focus on re-election. So if you understand the people that vote this person into office, the people that they represent, that could help you make the message such that it would resonate with them or make it touch them and make them want to act on it. Monitor their activities, know when they're speaking, making public appearances, follow them on social media, because that can give you insights into what their beliefs, their priorities are. Build relationships. You can establish, especially when you're part of a group, you can do so on an individual level, but as part of a nursing organization, making sure you get relationship with those policymakers and their staff. The staff is really important because the staff is generally the gatekeeper. So you need to not develop relationships with them and treat them extremely respectfully, because they make or break you getting to get your issue before that representative. And as I said, engaging with advocacy groups, collaborate with other groups, associations, coalitions that may already have relationship with the policymaker. Working together can really help. If you're going to put forth an issue, you need to research and analyze it. So you want to make sure you define what the issue is, gather data and evidence which will support your issue. It's evidence-based. It's not emotions-based. It's not feeling-based. It's not, this is what I think based. Gather evidence, and data is always good, important, because data talks. Data can't, well, you can present data in different ways, but numbers are numbers. Identify stakeholders who are affected by the issue, and you might be able to bandwidth or use to support you. Understand what the political landscape, and right now that is extremely important. Research what exists related to the issues, what policy are currently in place, how they've been implemented, what was their impact, but also when you look at the policy landscape, look at what's going on right now politically and know who is your best bet to assist you. Look at the political environment. As I said, what's going on? What are the political dynamics? Who are the key decision makers and people of influence right now? Public opinion is extremely important. See what the awareness is of the issue in the public sector. Find best practices and success stories as you research. Not just about whatever you are researching, what's the issue, but also about how similar issues were successful and what strategies did they use, what lessons did they learn. And then consult with experts like researchers, academics, practitioners. Get their insight and expertise in quotes to help strengthen your advocacy efforts. So how do you identify the stakeholders? Here are some steps. First, clearly define the issue that you're advocating for. That'll help you know who is affected by that issue. Identify direct and indirect stakeholders. Direct are those directly impacted by the issue, and indirect are those who are, of course, indirectly. A direct stakeholder is somebody who is, say, a patient, a healthcare provider, a facility, and indirect could be the insurance company, a pharmaceutical company, government agencies that are paying for healthcare or affected by the issue. Think about, unfortunately, you got to think about power and influence. Stakeholders vary, and there's different types of power. There's emotional power, there's political power, there's the power of money. So think about all of those things. See how stakeholders are related to each other. That can help you determine which stakeholders are allies and which are opponents to your efforts, so that you can manage that as you put things forth and know what both sides are saying. Engage with the stakeholders. Understand what their perspectives, concerns, and priorities are. Don't just assume because you know something is good that the stakeholders are aware of why or how it's best for them. You have to of course, include them and get their takes on things. And then look at stakeholder dynamics. How are they changing over time? It's important to stay informed about what's going on and adapt your advocacy strategies to what is happening and how things are evolving. Developing policy goals, it's the same sort of thing. You identify a problem, you have to set specific objectives related to that goal. And there's an example here. Like if your goal is to improve access to health care, a specific objective could be to increase the number of facilities in underserved areas. Consider feasibility. If you want to force something that you know the current people in power are not going to support, you need to figure out a way to counter their opposition. You want to see how many people will support you and what the resource availability is, and then prioritize goals. And it's two ways: importance and feasibility. You need to have achievable goals, just like when you were in nursing school and you were care planning. There needs to be what you focus on in developing a policy goal here is short and medium term goals. Long-term goals are really not as open for this sort of lobbying and advocacy, because people want to see change now. They don't want to advocate for something that might change in 5 years. They want to see change now. Align with your values and mission, either your personal values and mission or any organization that you are aligned with. And I think that even though we don't have a values and mission statement, we all do have our personal mission and our personal values. Try to, and being true to yourself and being true to your organization will make you more credible and consistent. Consult stakeholders, engage with them, get their feedback. You want to make sure your goals are relevant and reflective of what the priorities and needs are at this time. Develop an action plan. Once you have the goals, how are you going to reach the goals? And you should have timelines, who's responsible for what, and key milestones, or like this is, by this time we want to do this, by this time we want to do that. You don't, even though you want it to be short or medium term, you want to make sure that there are spots where there are touches to make sure that things are progressing the way that they should be, because a policymaker would want to see that. And then monitor and evaluate your progress. How are you going? How are you achieving those goals? Adjust your strategy as needed based on feedback you're getting in a changing political or healthcare environment if it's in a healthcare issue. Building relationships with policymakers when you can is an important thing. Before you talk to them, you want to understand their perspective, priorities, what they believe is important, what political landscape they're dealing with. You want to provide value. If you could give them research findings, data analysis, access to best practices in the field, help them get the research to make informed decisions. Build a network, attend conferences, events. I know the Ohio Nursing Association always has a day at the Capitol with policymakers that any nurse can come to. Being seen by them is important. Be transparent. You want to build trust, so you don't want to have a background agenda to your forward agenda. And then follow through. If you make commitment or promises to them, make sure you follow through. Engage consistently. Just keep on their radar. Seek input and feedback. Ask them for input into your work that you're doing. That will demonstrate that you respect their expertise and their perspective. Stay informed. You need to be on top of policy development and changes, because that'll change. Number one, it could change your approach, but number two, being knowledgeable about changes will show that you are a reliable source. And adapt to their style. If they have a different communication style, some people want to talk on the phone, and I know a lot of generations today don't like to do that anymore. Email, text, whatever way they best like to communicate, consider their preferences, and then always be professional. If you have personal connections, you should try to use them. They can be very valuable in building a relationship with the policymaker. Identify connections. Think about your relationships with policymakers, your relationships with people in your organization or colleagues or acquaintances that work in government or might have connections in the policy world. Seek introductions. If you know somebody with connections, ask them to introduce you to the policymaker. Attend events such as fundraisers, networking events, town hall meetings, where the policymaker is likely to be there, and then offer value. You want to give them something in return, just not your name, and that could be, as we said before, information, expertise, or any resources. And that resources can be connections to people in your world that can help them. And then be genuine. If you're fake, they're not going to want to work with you at all. And they are politicians, so they know fake. When you communicate with them, do it regularly, be concise and clear. Customize your message for the politician and the specific interests and priorities of the policymaker. Use multiple channels to communicate: email, calls, in-person meetings, texting if that isn't an option. Some younger politicians, you're not texting their personal phone. They have a phone that's just for their position. And then give them timely information as you get that, especially relevant to ongoing current policy discussions or decisions. And seek feedback. Make sure that you're not just trying to tell them what to do. Ask their opinion so that it's a collaborative relationship. Follow up. Once you've spoken to them and are interactive, send a follow-up, "Thank you for listening to me" type of email. Or if they ask for additional information, or if there is new information, follow up saying, "I'm glad we could talk. Here is some more information." Always be respectful, stay informed, and be on top of both your issue and what's happening in the world of the policymaker. It's not just about delivering messages, it's two-way communication. Listen to their perspective, even if it's not always totally in support of what you would like your issue in regards to your issue. Be persistent but patient. You need to understand that they have busy schedules and sometimes they drop the ball, and you need to not feel disrespected by that, but know that they are very busy, but be persistent. Crafting the message. How do you make the message when you're communicating? It's crucial. Understand your audience and tailor your message to that specific policymaker or audience if it's a group you're addressing. Be clear and concise. Highlight the impact. How is it going to benefit their constituents or society, but mostly their constituents, or if there is a pressing emergent issue that will affect all of us, that is another thing to highlight that impact. Provide evidence, just don't state your opinion. Address counterarguments. Say, in regards to staffing, when we try to say that we want to put a minimum nurse-patient ratios, the healthcare providers, the healthcare facilities will have a counter argument about there's not enough staff, there's not enough money. They'll have a counter argument. You need to show that you considered their argument and why that your position still is strong in the face of their argument. You want to use stories and examples. Real life stories impact people, and make it more relatable what you're talking about. You want to focus on solutions. People don't want to just hear your problems and the things you want them to do. Show that you are being proactive and constructive by saying, here are some possible ways to address the problem, solutions to the problem. Always, of course, be respectful and professional, even if they are disagreeing with you. And follow up again after sending your message. You want to follow up to see if they have any questions or want further information. It shows that you are committed to the interaction. And feedback. Be open that you are open to receiving feedback on your message, and you want to engage in constructive dialogue. Here are some strategies for effective lobbying or advocating. You want to do your research and planning. You build relationships. This is just a summary of what we've talked about and how there's strategies. Educate and inform. Strategic communication. Get a grassroots supporters, join with others to have in support of this, whatever you're lobbying for. Be persistent and flexible. Always follow up. Always comply with ethical and regulatory considerations. Evaluate and adapt. If you're if not being effective, adapt to a new strategy. And you can seek professional guidance, and as nurses, generally, we can get professional guidance from nursing organizations. If you recall, when I posted in the announcements where places to go find topics for your policy papers, what I did was go to major nursing organizations and link you to their policy initiatives that are currently going on, so they can help you. Overcoming challenges. Limited resources, you have to prioritize and try to get grassroots advocacy going. One great thing about social media is it is a great way to mobilize people. Competing interests. You seek common ground with people that might seem to be competing with your policy or your cause, and show the policymaker clearly how yours differs from similar but not as focused issues. If you have lack of assets, build relationships and utilize professional networks to get access. Simplify complex issues and use concise, evidence-based information to support your position. This isn't a flowery, trying to impress my instructor type of letter. This is clear, concise, professional communication. Anticipate that there's going to be people that have counter arguments and will oppose you, but continue to highlight the benefit of your cause and address any concerns constructively and respectfully, even if you are being attacked. Consider regulatory and legal constraints to overcome those. Stay informed about any regulations that there are about communication in this manner with politicians, and comply. And work with, if you need to, work with legal experts to ensure compliance. Those legal experts will generally, for us, we're not going to, especially if it's personal or a small group, you're not going to go get a lawyer, but we do have organizations that can help us. And be adaptable, because the landscape is always changing. You want to educate the public and try to get the public on your side, how your cause benefits them, communicate with them, and highlight the positive impact of your advocacy on the community. Prioritize lobbying efforts based on your lack of time, and efficiently communicate. And frame your advocacy in terms of positive change and progress to overcome resistance to change. And show examples of other successful initiatives to show people the feasibility and benefits of your issue. And that's it for this week's PowerPoint lecture. Have a great week, and contact me with any questions you have as we are going into the end of the semester.